as a jail physician. So again, I am an emergency medicine physician. I also work at an urgent care at one of the biggest jails in the city of Los Angeles. There's about 17,000 prisoners, mainly men, but we also see some women. Again, it's supposed to be an urgent care, but the facility, the way it's run, it's pretty inefficient. So we end up seeing a lot of unnecessary things. There's a lot of psychiatric, illness at the jails. So the most common things we see are, minor trauma. There's a lot of fights. So we do have the ability to do x-rays, and there's a scanner for head and face CTs because that happens very frequently. Lots of nose fractures and hand fractures and a lot of ortho pathology. There's a lot of foreign body ingestions. A lot of the psych patients tend to do that a lot to get attention, to have to be transferred to an outside hospital. So there's a lot of gray where I think if you're not an experienced practitioner, there's a lot of nothing, but then somebody shows up who's really sick, and other providers that are either don't have the same training might think it's just another nothing, right? When the patient is actually very ill, whether they're altered, not everybody has psychiatric disease. Maybe they're truly altered for some other reasons. So I think there's some interesting pathology there. Of course, they don't have their families there. So that part is non-existent really. So we try to counsel them, but I think it's a really challenging population for many reasons. There's a lot of younger patients that I feel really sad for because they should not be there. So I keep thinking, how did this, 19-year-old get here? He's only 19. What if he would have educated differently, or he had other opportunities? And so I keep thinking of all those things, and then I have to refocus and say, okay, let's take care of your problem and drain your abscess, or, remove your foreign body or something. So it is challenging. A lot of them don't have the will to have a conversation about their health status. A lot of them don't want help. A lot of them want all the help because they get it for free in the prison system, and they don't seem to have concerns about their health once they are released. They are only concerned once they're in there. So there's a lot of challenges, but I think I find it interesting nonetheless. And it's a little less busy than my regular emergency room. So that's why I try to balance that out a little bit working there as well.